Hi, future nurses, welcome back to the channel. Today we are covering one of the most important NClEX topics, basic care and comfort. Many students think this section is easy, but this is actually where a lot of students lose simple marks. Why? Because they focus too much on medications instead of nursing care. The NClEX wants to know, can you keep your patients safe, comfortable, clean, mobile, and complication-free? So in this video, we'll go through the most important areas you must know for basic care and comfort, along with high-yield NClEX tips and nursing interventions that commonly appear on the exam. Let's get started. Let's start with assistive devices. Patient safety and fall prevention are extremely important on the NClEX. When teaching a patient to use a walker, adjust the height so the handles are at hip level. Encourage proper gait training and promote independence whenever possible. Remember this important NClEX tip: walker first, then weak leg, then strong leg. For canes, hold the cane on the strong side. For crutches, support weight with the hands, not the armpits. Patient education is critical because improper use can lead to serious falls and injuries. Elimination care focuses on infection prevention, comfort, and dignity. For urinary catheters, maintain a closed drainage system and keep the drainage bag below bladder level. Avoid tubing kinks and perform proper perineal care. And remember, always wipe front to back. This helps prevent urinary tract infections. The nurse should also protect patient dignity by providing privacy and explaining procedures clearly. Responding quickly when patients need assistance is key to providing professional care. When patients stay in bed too long, serious complications can happen. Immobility increases the risk for deep vein thrombosis and pneumonia. It also increases the risk for muscle weakness and painful pressure injuries. That's why the NClEX loves early ambulation. Whenever possible, patients should begin walking within 6 hours after surgery. If the patient cannot walk, perform range of motion exercises and encourage ankle pumps. Use compression devices and reposition the patient every 2 hours. Movement protects circulation and skin. Nutrition is not only about eating, it's also about safety. For patients with dysphagia or swallowing difficulty, use the chin tuck method and keep the patient upright during meals. Keep them upright for at least 30 minutes afterward. These are called aspiration precautions. The NClEX also tests therapeutic diets, such as renal diets for kidney disease, low purine diets for gout, or fluid restrictions for heart failure. Monitor feeding tube rates carefully. Always watch for nausea, vomiting, or aspiration during and after nutrition delivery. Hygiene is one of the most important nursing responsibilities. Clean skin helps prevent infection. Important nursing interventions include bathing, oral care, and changing linens. This also includes perineal care and detailed skin assessments. For ventilator patients, mouth care is extremely important because it helps prevent pneumonia. And remember, moisture damages skin. Always keep the patient clean and dry. Sleep is essential for healing and recovery. To promote better sleep, we must manage the environment. Reduce noise, dim the lights, and keep the room cool, around 68 degrees Fahrenheit. Avoid screens before bedtime and encourage a consistent sleep routine for your patients. The NClEX often prefers environmental interventions before sleep medications. One major NClEX rule is this: try nursing interventions before medications whenever possible. For pain relief, non-pharmacological methods include repositioning, heat therapy, cold therapy, massage, guided imagery, relaxation techniques, TENS units. This also includes guided imagery, relaxation techniques, and TENS units. These methods are safer, less invasive, and commonly tested on the NClEX. Students commonly confuse hospice and palliative care. Hospice care is for terminal patients, usually with less than 6 months to live. Palliative care is comfort-focused care that can begin at any stage of serious illness. The nurse's role includes providing comfort, supporting the family, and managing symptoms. Sometimes simply being present is one of the most powerful forms of nursing care. To succeed on NClEX basic care and comfort questions, always remember, safety first, nursing interventions first, medications later. The NClEX rewards nurses who prevent complications, protect dignity, and promote comfort and education. Keep practicing, keep thinking like a nurse, and you will do amazing on your NClEX. Thank you for watching, future nurses, and I'll see you in the next lesson.